So I'm Rhonda Nash. I'm the team coordinator for emergency retrievals in health records at the Mater Hospital.
My name is Kathy Perrin and I work in the process excellence team at Mater Health Services.
My name's Glenn Bevan. I'm the owner and managing director of Infinity Design.
The back table. Now, it's the only table that I've ever known. We've always used a system which is just a rectangular table. All the returns, which we have about 2,500 per day, come to the back table. They get processed and sent to other relevant departments, and in that way they just had them all stacked up on the table, and when we process some of them they go in a different direction, and that was the only set functions that we had for that particular table. The table was very stringent and no movement in it whatsoever.
We actually looked at the value that that process created, and there was a lot that it created. In terms of checking the charts, making sure that they were streamed to the right locations, in terms of coding, which is all about us getting our money, in terms of going out again to other departments immediately, which is about making sure that patient care could be provided. So it provided a lot more value, I think, than perhaps people realise.
We were engaged by Mater Health Services because the system they had for handling their health records was inadequate to handle the amount of records that they were handling each day. So we came in and looked at their systems, we talked to their staff, we observed what they did on a day-to-day basis. I think we realised that it was a much deeper problem that needed to be solved, not just a product. The system and the workflow around how that worked was the most important part of the design. So what we did, we helped them with their system design, along with providing a product which had multiple sections and allowed the health records to be unitised into small boxes, and these small boxes were easily manageable from an OH&S perspective, and they were allowed them to move quickly from the dumping station through to sorting, through coding, and then back into file or to the finance department or many other areas of the hospital where they need to go.
So being able to process the charts quickly and get them back out to those clinical areas so that patient services can be provided is really important, and the back table has helped do this. So where previously charts were stacked haphazardly on the table, and it was really difficult to find a chart if you needed to in a hurry, they're now all stacked into plastic buckets, their spines are up, you can see the patient's UR numbers, and it's much easier to locate those charts and get them back out quickly.
It's been fantastic in all areas. We're not reaching over. There's so many bonuses, and the staff absolutely applaud the design. Before it went into production, we asked the Work Health and Safety Unit to come down and assess it, because they had many problems with our previous table, and so they went through every single aspect of it, of which it passed with flying colours. We also have the flexibility with our processing area. We have the possibility of moving the desk along to the relevant buckets, so we totally avoid having to reach over and stretch. Now, because with all of our health records they need to have relevant stickers placed on their front cover, that includes like extended retention stickers for children, so we didn't have an area that was defined for the sticker processing. We have this magnificent rolls all placed in front of us now, so they're at eye level, they're on a structure that they can all be fed onto, and they're there easily, and that is the biggest time saver out of everything else. I find that to be the biggest one for me.
There were a number of workplace health and safety issues with the original table, so we wanted to design as many of those out as we could. So one of the solutions that we came up with was to have a sloped panel, so that once you filled a bucket it was really easy to just move that bucket to the next part of the process. So before it actually involved a whole lot of physical effort to shove the chart along. Now it's just a question of sort of tipping the bucket down a little ramp. So that's much easier on the staff, and certainly the workplace health and safety team much happier with that solution than what the team previously had to work with.
We took a slightly different approach to this project than we would normally for a product development sort of project. and we accepted the challenge, and I think we've come up with a great solution that not only helps their processes within the hospital, it's improved their service delivery and improved the way that the whole hospital functions with their access to medical records.